This is emPowerHour. I'm your host, Deshauna Spencer. So today I'm dedicating my show to women's health. In our first segment, we're focusing on uterine fibroids. For those who do not know what it is, uterine fibroids is a non-cancerous tumor that I heard affects between 20 to 40% of women by the time they're in their 40s. But for African American women, we are 3 times more likely to have fibroids and exhibit symptoms. In addition, Black women get fibroids earlier in our lives. So to discuss the causes, the complications, and treatment options, today I'm really excited to have in the studio Dr. Paul MacKoul. He is a gynecologic surgeon with the Center for Innovative GYN Care. Welcome to the studio, sir.
Thank you. Pleasure to be here.
And joining us in just about a second, I have Celeste Doaks. She is a professor at Morgan State University. She recently wrote her story about her fibroid journey, and the article is called Getting Fibroid Free, My Journey to the Lighthouse. And welcome to the studio, Celeste.
Hi.
Glad to have you here. So if you have any questions or comments, you can call 202-588-0893 or hit me up using the hashtag emPowerHour. So I gave a very, very small description of what a uterine fibroid is, but doctor, I really want you to kind of give a large overview of what uterine fibroids really are.
Yeah, so fibroids are actually fibrous growths that grow in the muscle of the uterus. So a person can have 1 fibroid, they could have 50 fibroids. It depends upon their genetic makeup and their history. So they can occur extensively and cause a lot of problems, pain, bleeding, and other issues.
And we talk about genetic makeup. Are there particular people who are more likely to get fibroids?
Yeah, African Americans are a good example of that. They really have a very high incidence of fibroids. Some Asian populations as well. Caucasians, not so much fibroids and other issues with GYN, but African Americans are probably the most relevant.
And do we know why? I was doing a little bit of research, and I know it can be hereditary. Like in my case, my mother had 1 big fibroid. I had 20 removed initially, then I had another procedure because I had more. Is that typically the case for a lot of Black women to have it in their families?
Yeah, it really does run in the family. You'll have people that tell histories of having fibroids in their grandmother, their mother, their sisters. Absolutely, that's a very common situation.
And I really feel like, her mother could have had them, but the times were different where a lot of people weren't maybe seeking help like we are now, and who knows, but I want to really talk about causes. I know it's in our history, but do we really know what the causes are, or are there real causes to fibroids?
Well, actually, I think it's very important for patients to know that the only thing that really makes fibroids grow is estrogen. Mm-hmm. It's not coffee, it's not chocolate, it's not anything like that. It's not red meat. It's all about estrogen that your ovaries make. So as long as you're making estrogen from your ovaries, you're going to grow fibroids if you have that propensity. So estrogen is the cause.
Right. And I want to bring Celeste in on this conversation because I was reading your story. You're a vegetarian.
I am.
Yeah.
I have been for a long time.
Yeah. And I remember when I had my fibroids, people were telling me, maybe just give up this or give up that. But that wasn't your case.
No, it wasn't the case. Like I said, I've been a vegetarian probably for about maybe 15 or 16 years, long time. Pescatarian, I eat fish. Okay. But like you, genetically, my mother also had fibroids. So I think sometimes maybe if it runs in the family, you're going to end up, no matter kind of what you do, you're going to end up sort of developing these fibroids.
So you knew early on, since your mom had them, that you probably would have them no matter what.
Right. I kind of estimated, I guess you would say, but I wasn't diagnosed until about 3 years before I actually had my procedure, and then they just sort of escalated. They got bigger, and so I didn't know. I sort of maybe I had an idea that maybe I might have them, but there's no guarantee. I think just because your mother had them that you'll have them. So I don't think it's a direct correlation, but it does seem that it does run in a matrilineal family.
In your case, you started to exhibit some symptoms. And did you know right away they were fibroids, or were you thinking there was probably something else? No,
I started to gain weight initially a little bit slowly, and so I wasn't sure whether or not the weight gain was due to the fibroids or not. But then exponentially, especially in my abdomen area, I started to see it being distended and looked puffy. It started to look a little bit like a pregnancy, and I knew by then that something was like seriously wrong, and that I needed to get these, looked at again and see what might be possible, in terms of something to do in terms medically to help me.
And Dr. MacKoul, is that typically when people come see you, they're in a space where maybe they should have come to you sooner?
Yeah, unfortunately, a lot of people suffer.
Mm-hmm.
I mean, you mentioned, in the past, it was a norm to have heavy bleeding and distension and pain with the periods is what you'd expect. But of course, that's not the case. I mean, people will have progressive increase in their symptoms, and then at some point it becomes intolerable, and then they usually seek care.
It makes me think about like my own personal case, because I remember I found out I had fibroids probably like 25, and my initial OBGYN, oh, it's no big deal, if they grow, we'll do something. But they were growing, and eventually I had to have surgery because they were affecting my kidneys. They were literally pushing down on my kidneys. But I waited too long, and unfortunately that happens in a lot of cases where maybe a OBGYN may say, no, wait, but that shouldn't be the case, right, doctor?
Yeah, we can go a little bit more into the OBGYN, but that's a very, very common situation where someone has symptoms and the OB will say, well, if they're not really that symptomatic, if you're not having that much bleeding, let's just wait and see. Remember, if someone's in their 20s and they want to get pregnant in their late 20s or 30s, these are going to grow for another 5 or 10 years.
Right.
And then they're going to essentially destroy the uterus unless they're taken care of at some point relatively quickly.
Right, and thank you for that. And Celeste, so when you found out about this center, you were doing a lot of research, right, about various options.
I was doing a lot of research, and I also had done a lot of person-to-person research in terms of visiting a number of doctors who I was very dissatisfied with their diagnosis. Most of the doctors were telling me that I had the possibility to wake up without my uterus, in terms of having a really dangerous sort of open, long recovery sort of surgery. And, those possibilities were not, exciting to me. So I kept searching. So I was doing, both online and reading some books, but I also saw quite a few doctors before I came to the center. So, yeah.
And I want to talk about, because you mentioned the open surgery. It's called an open myomectomy, doctor. If you can talk a little bit about what that is.
Yeah, open surgery, and I think Celeste used the word dangerous. The situation there is that an open myomectomy can lead to heavy bleeding and a hysterectomy. But we've got to be sure who we're talking about doing the surgery. So an OBGYN, can have those situations. If a specialist is involved, you can actually prevent open myomectomy. Open myomectomy is a large cut, anywhere from 6 to 8 inches up to 10 inches in size, and you're taking fibroids out through the abdominal wall. That's usually a 2 or 3 day hospital stay, and typically about 6 to 8 weeks recovery. Versus a minimally invasive approach, which is essentially 10 to 14 day recovery. So again, it's the specialist versus the OBGYN, and open myomectomy versus laparoscopic.
And so talk about the LAM procedure, which is what Celeste had, and the difference. You mentioned briefly about the difference about, the recovery time, but even the incision is very different as well.
Yeah, the incision is, and Celeste mentioned, that there'd be a lot of bleeding. Well, blood control is the key. So with the LAM procedure, which is laparoscopic assisted myomectomy, you're controlling blood supply by putting a tourniquet around the neck of the uterus where the blood is to the uterus. So you're actually handicapping the uterus. You're stopping all the blood supply temporarily, taking out the fibroids, and that stoppage doesn't hurt the uterus. It's a muscle. And then you take the tourniquet off after the uterus is closed. So that's why hysterectomy is almost unheard of with the LAM approach that we use.
And do you feel that the LAM should be the only approach? Do you even see women needing an open myomectomy to treat fibroids?
Absolutely not. We take fibroids of all sizes, shapes, and weights with LAM. LAM has taken out up to 160 to 180 fibroids from one patient.
Wow.
It's taken out fibroids up to about 15 pounds.
Wow.
That's huge.
Yeah.
That's the size of almost a beach ball.
Yeah, my mom in her 40s, her size, it was a basketball, and they took pictures of it and everything, but she had a hysterectomy, a partial hysterectomy.
Right. And again, it's difficult for an OBGYN to understand what a LAM is, but again, it's a specialty procedure. It's involving controlling of blood supply and how the fibroids are removed to give you a very good success rate.
Right, and for Celeste, it was really important to you because you wanted to have children.
Right, or at least have the possibility to consider that option. I think, a lot of women are worried about hysterectomy because that means obviously there's no chance of them having children. So getting that diagnosis from a lot of OBGYNs was really disappointing to me. So I wanted to go with an option where at least I would feel confident that I wasn't going to have a hysterectomy and have my uterus removed. So that was important to me.
Yeah, and it's a scary thing, too, to think about the fact that you can wake up and then your uterus is gone. That's a scary thought. No one wants that.
And again, if you're having heavy bleeding during procedure, that certainly can happen. It's just very rare if you're using the techniques in the Lamb approach. So I think patients need to understand, if you're told you may have to have a hysterectomy with a myomectomy, again, removal of fibroids, there is a better option than the approach that's being discussed with you.
Right, or a doctor may tell you may need to get a blood transfusion, or they may want to take your blood beforehand just to make sure that everything's okay as well.
Right. Well, again, with Lamb approaches, if you have a huge fibroid, the issue of transfusion is always there.
Okay.
And it sometimes is needed in rare cases, but hysterectomy typically is not.
And I want to also talk about another procedure that we heard a lot about, which is the artery embolization, which is another procedure that I had 2 years ago. But we were talking kind of offline about that procedure. If you can talk a little bit about that and the differences. Yeah.
So UAE or UFE, they're both referring to the same thing. Uterine fibroid embolization is when a radiologist actually takes a small catheter, threads it through the large vessel of the groin, and finds the vessels to the fibroid and then blocks them with little plastic particles. So this is a pretty good approach to control bleeding, but in a younger patient, the long-term control of that fibroid is very limited. Several things can happen. Additional fibroids can grow, or the fibroid that was embolized will reestablish a blood supply. Now, there are also controversies with embolization and fertility, so we highly recommend that if patients are told they can get embolized and they still want babies, they should reconsider that approach, because it can affect implantation of the embryo into the lining of the uterus where the baby grows.
And you hear so many conflicting things. I know I've had that procedure, and the particular doctor told me that he couldn't guarantee, but there were women who were successfully able to get pregnant. But you don't really you shouldn't take any chances, basically.
You shouldn't, because if it's with fertility, you have to preserve blood supply and you have to preserve the lining. You can get pregnant from a variety of different ways, typically IVF without fallopian tubes, but you still need ovaries and eggs, and you still need a lining. So you want the lining to be completely preserved, which would be not embolization, and you want to have the ovaries in good shape so you can retrieve eggs if you need to. The tube's a little bit more variable with myomectomies because tubes are more subject to scarring. But I would avoid embolization for people that want fertility.
Okay, if you have any questions or comments, you can call 202-588-0893. And Celeste, I really want to go back to you to talk about your experience, because after your research, you did decide on the Lamb procedure, and your experience, I'm sure, was much better than someone who had an open myomectomy.
Yes, it was. I mean, my experience was fantastic. It's fantastic, absolutely. I mean, I felt like in consideration to the open myomectomy, right? I mean, all of the long recovery time, being open, the possibility of blood transfusion, which Dr. MacKoul is saying is always there. But I had none of those things. I don't know if I'm a rare patient or not, but I had a fantastic surgery, and my recovery time was shorter than 2 weeks. I mean, so my incision was small. I felt like going through outpatient surgery rather than having to have a 2 to 3 day hospitalization or stay was really a big benefit for me too. So, I felt like all the way around my recovery time was short. I felt like the incision was small. I felt like basically this was like a dream procedure.
Yeah.
And just so, Celeste, did you have it done at a surgery center or a hospital?
I had it done at a surgery center.
Yeah. And this is one of the newer things that people are doing now. We've always used a surgery center, which is a small, very highly refined hospital with very good staffing and equipment focusing only on GYN surgery.
Okay.
So it's sort of unheard of to do a fibroid of Celeste's size in a surgery center. But again, if you're using techniques that we're using with great staffing and great equipment, you have very good results. And, Celeste is an example of that.
And it's probably cheaper to do it at a surgery center than even going to the hospital and all the drama of being there, too.
It's actually much less expensive as far as the payer, the insurance company, depending upon the insurance. But it's a better overall experience for patients. There's less infection rates. There's much higher satisfaction rates in a surgery center versus a hospital. Remember, a hospital, you could be in there getting a surgery for a fibroid, and down the hallway there might be a bowel surgery, and up the hallway there might be a neurosurgery, right? And you often don't have staffing that's centering on what you're doing. At a GYN-only surgery center, it's only GYN surgery.
Right. So they have a special training on, okay, this person is experiencing this particular complication from the surgery, and they know exactly how to treat it.
Exactly. Yeah.
Wow, I didn't realize that it existed. And you also mentioned a traveling type of option too at your center. Yeah,
we have a pretty good following online in other areas. We have a lot of patients that are interested in doing it because their OBGYN says they can have it done.
Right.
So there's a travel program that we have that allows patients to access that program online through the website, and they can come see us. And they do. They come from all over the country. They come from different countries. New Zealand. There was someone from New Guinea that made a inquiry a while ago, and they come here for that operation to get it done so they can actually have a fast recovery and a good procedure.
Wow. And how long has this LAMP procedure been around? Because I had never heard of it, and I've had 2 procedures already.
Yeah, that's unfortunate. Remember, we're only 2 surgeons among about 600 to 800 OBGYNs in the metropolitan D.C. area. So it's really hard for sometimes us to get out there and be accessible to patients. But it's been going on for a long time. And it's been very, very successful. We've done series of surgeries that are now being published soon on the technique, which hopefully will help expose it. But it really is about patients doing their research. The most important thing is patients being their best advocates, their own best advocates. When you think about it, can you really rely on your OBGYN to give you the best advice possible? I mean, Celeste is an example of showing us examples of how that may not be the best advice. And the primary care physician often doesn't know anything about fibroid surgery. So patients are often left for themselves to navigate through this crazy quagmire that we have of medical care to try to find out the best option available. Right.
And I mean, I've heard studies about women sometimes saying they're having these issues, and maybe even the physician saying things are in their heads and not really exploring, I've heard stories. Celeste is looking like, how dare that doctor? It's happened to me, honestly, and it happens all the time. How can patients be empowered to seek out the help that they need, and what should they be looking for? Because there could be people listening right now. It's like, do I have fibroids? Okay, my stomach is a little bloated, but what else should I be looking for? Is it just because I ate, something that I shouldn't be eating?
Yeah, typical symptoms of fibroids are I think most people have a concept of what they are: heavy bleeding, pain. Interestingly, frequency of urination. You got to pee a lot because the fibroid's pressing right on the bladder. And then the fibroids compress on the bowel, causing constipation, back pain, pelvic pressure, abdominal distension, bloating, infertility. So, okay, you have those symptoms. What do you do next? Well, unfortunately, you go online. I say unfortunately because most people go to sites that, don't give them the correct information.
Yeah, then people think they automatically have cancer or something like that.
And then they start wading through that. And, people who are really dedicated to finding a better option will find it. Most people are pretty smart. They'll go to their OB, they'll get some ideas from the OB, maybe what they do and do not want to do. And if they're dissatisfied, they generally will, get to where they want to go. But realize that most patients who go to their OB get operated on by their OB. Celeste is unusual. So we have a 80% open myomectomy rate in this country, a 60% hysterectomy rate that's open in this country. So those are people who are getting all pretty morbid surgeries that they don't have to get. They could have done them laparoscopic if they found a better option.
Right. And we were talking offline about the difference between being a surgeon and someone being an OBGYN and the difference in how many procedures they do a year.
Yeah, so as specialists, that's all we do. So, anybody who's looking for a specific surgery, whether it's GYN or otherwise, go to the specialist. Go to someone that does it all the time. If you find that specialist, you're going to get a better result. An example, to make it very basic, you've got an electrician looking at your, electrical panel, or you have, someone who is sort of a handyman looking at your electrical panel to fix your electrical system. Who are you going to choose?
Right, exactly. The specialist.
You're going to choose the electrician as the specialist. You're not necessarily going to go with a handyman. So the same thing happens with surgery. It's really that basic. Look for that specialist, and they'll give you a better result, than the generalist will.
And for you, Celeste, you went to how many gynecologists before you selected with the center?
I definitely had meetings with 3 to 4 different gynecologists that just said things that were horrible to me, and so I felt like I needed to keep searching for another option, But also, Deshauna, referring back to what you were saying earlier about how do women go about advocating for themselves? I think one of the big things is that women feel insecure and they feel afraid about this issue, right? So I talked to friends and found out that I had friends that had the open myomectomy. I had friends that had embolization. Once I started to open up, but for a long while I was like, scared to talk about this issue or, really fearful about what to do. So I think one of the things about being an advocate for yourself is talking to other women and finding out whether or not they've been through the procedure, in addition to doing what Dr. MacKoul is saying, which is doing research and things like that. But once I started to talk to people, I started to hear different stories. And like I said, most of the stories with the open myomectomy were not friendly ones.
No, I was bent over for a month, and my husband had to carry me downstairs for 3 weeks. It was not fun, and when I need to have a surgery again, my doctor did suggest the open myomectomy. I'm like, over my cold dead body, you're going to open me up. It's never happening. And I just refused to get opened up again because it was such a traumatic experience to be opened up. Talk a little bit. We're going to say something, doctor?
Yeah, well, the open surgery, if your patients need to know, you're cutting through skin and then fat and then muscle and then the lining of the body called the fascia. It's extremely invasive. And because of that, you really can't walk very well. The healing process is a lot longer. But also your scar tissue formation is higher. You'll scar the tubes more frequently, which is where the embryo transports to get to the uterine cavity to implant.
Right.
You can get wound infections. You can get wound breakdowns. And then if you're held up or in the hospital in bed for days, you can now get clots in the leg, clots that go to the lung. I mean, the list goes on and on. It's also a higher blood loss rate with open versus the lamb procedure. So again, if you understand that, hopefully this program is helping to educate patients in that regard, then look for something different. Look for that specialist, look for a different approach that gives you an option away from all that stuff.
And really look at other choices. I think a lot of times, when we're in a particular situation that's medical, we may be afraid, well, that's the doctor, and the doctor knows everything, so why would I assume that they're telling me something wrong? Because not they're telling you anything wrong, but there may be something who knows something better, with this particular procedure with lamb that I didn't know anything about. I think it's just being smart.
This is an extremely important point. Now, think about the OBGYN, and they're very good at what they do for obstetrics. I mean, they're experts in delivering babies. But is that OBGYN expert in surgery, in fertility, in some minor oncology? No, they're not. So I think it's important to understand that you have to go past what that OBGYN said. Just because the guy or girl has a white coat on and is sitting behind a desk and might be intimidating doesn't mean they have all the answers to what your problems require. So, I take a lot of advice from patients, and I listen to what patients have to say in order to help me get better. The OBGYN who doesn't have those particular skills should be referring that patient out to a specialist. And if they do that, a lot of what we're talking about wouldn't exist.
Right.
Open myomectomy and things like that.
Yeah, I totally agree. How are you feeling today, Celeste?
Oh, I'm feeling great. I mean, totally. I mean, like I said, the recovery time was so short. I mean, there were some things about not doing heavy exercising immediately after the procedure and things like that. But other than that, I'm feeling fantastic. I traveled to the UK in November, which was, a couple months after my surgery. So I feel fantastic.
Right, because people don't realize, even though so many women get fibroids, it can really damper your whole lifestyle. I mean, we were talking offline about a woman who's starting the White Dress Project, which I don't think I've heard of before, but for someone who's had fibroids, wearing a white dress or wearing white pants is something you don't really think about. You don't even want to, you don't never know what's going to happen. You may have a little accident, and as an adult, and it's not cool.
And that's very true, but also with that constant bleeding.
Yes.
You get tired. I mean, you may have had that, Celeste. You may have been tired and weak because you're losing all that blood.
Yes.
And then you live in a chronic state of fatigue for years. And so then we go in, take the fibroids out. All of a sudden, oh my gosh, 2 months later, I feel best I've ever felt. It's like Superwoman.
Yeah, right? I mean, you're right. I'm sure you probably felt that, Celeste. I was so Yeah.
I feel a lot lighter, all the way
Probably
lighter,
feel a lot lighter.
more energetic, everything. You know, my clothes fit better. Thank God I can wear my clothes again, and you know, all those sorts of things. Yeah, it's a world of difference, you know, but before and after.
Right, but the blood loss is pretty significant. I remember for me, the doctor's like, how many iron pills can you stand a day? Can you take 3, like really 3 iron pills a day? It's not happening. But yeah, you're right. I mean, women don't realize, we're thinking they're tired from maybe everyday life, when it could just be their fibroids really affecting them.
And be careful too. We have patients that are undergoing iron infusions. So there's a medical oncologist or hematology oncologist doctor that the primary care will send their patients to, and they'll give them iron infusions for a year.
Wow.
What are we doing? We're treating bleeding. We're treating a symptom by giving iron through an IV, which is very expensive, but we're not actually treating the cause.
Wow.
So, you know, you see these things all the time, and you wonder why. Take the fibroids out.
Right, exactly.
And then the bleeding stops.
So before we go, how can people learn about the center and get the procedure if they need it?
Best way is probably go to innovativegyn.com. And there's a wealth of information there, all about fibroids, what we do, what your options are. I think the most important point, it's an educational website. You can learn various options, learn about open, learn about robotic surgery, learn about LAM, and get a lot of that information to make an educated decision.
Great.
That's one of the best ways. Yeah.
Thank you very much. I spoke with Dr. Paul MacKoul. He is a surgeon at the Center for Innovative GYN Care, as well as Celeste Doaks. She is a professor at Morgan State University, and she wrote a really great article about her fibroid journey.
Thank you.
Thank you both for being here.